from what I got from Darlene, is that there are some areas which need further discussion.
No.
See, that is the position. So, and unfortunately, and that is why I wanted the county attorney's office to do an apology to you, because tentatively we said that we are organizing a meeting, but the confirmation of the meeting was not done, and the board was not, my office was not guided on the same, because they are the people who usually run with the recognition agreements, and even the CBA, they are the people who run yes, they are our technical team, and we also have the HR team who are also not here with us. So it is very unfortunate that I don't know. I feel that we might not, but what was, because we have the other union, which I think they're comfortable, and we are just saying, just organize about the signing. But yours, we need to, there's some clause which we need to discuss. So that is the position.
I think, thank you, Chair. First of all, I want to appreciate you most sincerely. For quite some time, I think public health officers and technicians have been neglected. And you know you are the employer. When you are sitting with the employer, we have an opportunity to discuss as your children, to discuss what will actually be befalling us. Just to begin with, even outside here, I know you are conducting interviews. I don't know whether you are sure, whether you are aware that you only have push from PHOs. I'm sure you are aware. And just looking at it against others, that one should be able to tell you something that we actually accounted that we actually want to breed diseases instead of bringing down the disease balance. So it's an issue that really, as a union, we actually not very, very happy with it. But because, like my blankets here said, we believe in social dialogue. We believe in discussions that actually supposed to build us and actually be able to propel us going forward. PHOs, from time immemorial, we're going by the Minister of Health. The week has been vacated of the Ministry, State Department of Medical Services, and then State Department of Public Health. Medical Services is known by what it does. It's purely secondary. It provides secondary health care, that is curative. We do primary health care, that is preventive, as per se. So we have been having issues because of the balance of the primary and the secondary aspects of the healthcare systems. So I want to thank you most sincerely for even out of your busy schedule, despite the fact that the invitation was not properly done. Actually, I was supposed to be in Embu today. I got that invitation, I looked at it. I was not very sure what's actually happening. And because we are people who honor invitations, we said, let's come nevertheless. Because this is not our first county to sign RA. Actually, it's going to be almost our 12th county. For the we have signed RAs for most counties. And we know the procedures, we know how invitations are supposed to be done, and what should be included in invitations. So I want to thank you most sincerely. And you can see we are here. That should tell you that really this, and by the way, even the issues that have been raised in that invite, they are not really big issues. Actually, they are actually very small issues that we can even, less than 5 minutes, we sit down and brush them over. Then we have the parties sit down and sign the recognition agreement. Because ideally, then they are not really, what the attorney has raised, we have also gone through them, and they are not really big issues. They are very small issues that we can always brush through, then have it actually signed. So I think we actually will be ready. Even if you are to tell us to sign at 4, we are willing to sit here up to 4 and allow you to organize yourself. I know there are members who are not here. Just invite them, because you just tell them that the national team is here together with the branch, and by the chairman, we don't go for strikes. We are one of the unions that don't advocate for going to strikes. We don't like paralyzing service, everybody. We want to be here, we want to work and make sure that we advise also our members who are PHOs in Laikipia County to work. So what we're actually asking is a simple favor from you as our employer and as our chair. I know within your powers you can do that, because I know the most critical person when it comes to signing one is the chair and the county secretary. They have said the Labor Relations Act is actually very clear, and maybe the chief officer, because those are the people now that deals with the departmental issues at that level. So when you have all those guys there, and then maybe the county attorney as the witness, we can always have this signed very fast. Whichever time it can be signed, we are willing to go whichever way. That one should actually tell you we are kind of very much committed. And want to thank the governor and in fact Honorable Joshua Rum for giving us the space to work, because actually I'm to prepare a very huge space in the KP and we need very much working. So I want to request you humbly, in your wisdom, because I know you are a very wise person, in your considered wisdom. And by the way, unaona vile watu wanaingia hapa, umeongelea kuona utuone. If you can use your wisdom and maybe have the parties come on board, we brush through, because the issues that have been raised are actually very small issues. We can even take less than 10 minutes to sign. Whichever time we recommend to Rudy, we can hang around. Because I can tell you free, the national team, I don't know about the branch, we have very tight schedules. We actually run on a very tight schedules, because like today, like I said, we are to be in M. You have a very serious matter in M. But we said now that like you guys invited us, we have to go there and see we have this actualized. So if you can do us a favor, Honorable Chairman, we look at it, invite the county attorney, invite even a representative from the county secretary's office. The CS might not be available, or rather, if we get a representative, we brush through the issues, then have the RSI so that we can be able to actualize why we actually here. With a lot of humility, because I know you are a very wise person. You can help us so that we can see what can be done.
Okay. Thank you very much for that question. But you know, it's always good to empathize.
It's true.
Put yourself in my shoes.
No, okay.
I have how many offices? We have the county attorney,
Yeah.
who is very crucial
Very
in that signing of that document and the preparation of that document, going through it and all that. We have the county secretary, and now we have the chair. We also have the department, that is the health, either the CEC or the chief officer. So now with this short notice, and that is why I started by first apologizing, because that invitation, the way you have just noted, is that it was not properly done. That is not the way. That this one should be now the third or fourth recognition agreement which I'm saying. So there's something which was years, and that is why, on behalf of my colleagues, that's why I feel that I have to apologize for that. But now, telling you stick around, I try to coordinate those offices. It is going to be a tall order, because as per now, already the county secretary had his own program which was running for the day. The same with the county attorney. So mine, I think the best we can do is to reschedule this meeting, and we make sure that we do it properly. And if anything, some of those issues we can even maybe decide first before the signing ceremony. We iron out, maybe through an online meeting, those issues which are there. So by the time when you will say it's just a matter of come and sign, and I think that is what I would advise and feel that it is. Because now trying to bring those people on board, might not be in a position to do it. Yes. I might be willing, but it might not be practically possible for us to do that. So I would request why don't we schedule a meeting and we agree, we pick a date which now yes, which is convenient, and so that we sign and then we get into the other issues, because the recognition is just the entry.
opening.
It's only the entry.
Yes.
The other issues which we are which are there. So this could be my proposal, and I also let me take this opportunity to say, when I'm meeting with the representative of the workers, I value them a lot, because as you had stated, is that the issue of having strike, to start with, when we talk about the health, yes, component, people going on strike is something which should not happen. So those people who have been given responsibility, like the position which I'm holding, I have to go that extra mile to make sure that I recognize the representative of the workers who are working under us, and we do things in a diplomatic way. Yes. And also, from what I know is that, sometimes people overlook the human resource, but the most valuable resource in any organization is the human resource, not the machineries or anything else. I have a background in the banking, and in banking, you could tell our staff that, is there anything which you sell? Bank don't have anything they sell. The money which they read is not their money. It's customers' money.
That's true.
So the only valuable thing which differentiates one bank to another is how the staff treats the customers. So
Yes.
it's the only
the customers.
yes. So like when we have staff here, even if we put up those dispensaries, we put up those instructors, and there are no staff to man them or to give quality services, the whole that whole investment will be useless. So we value you people, and when I know I'm speaking with you, I'm speaking with all the whole fraternity of the public health officers. Yes. So that is my position, and so this is my request.
I think you heard what the chair said. The chair is proposing something very valid, and in my opinion, it's good, because I think it's very correct. When you talk about signing an RA, you don't sign an RA with one party. Even if he was to agree and sign, that RA will not stand the test of time, because other parties are not actually present to sign. I think what we need to do, we need to take a time. We schedule this meeting for another time. I think Chair will guide us each other time. But I think the most important thing is the issues that have been raised in that area, and that means then we need to have two meetings. The one is proposed about the virtual one to iron out those issues. Then now we agree on the scheduled meeting date now for the signing. The date of signing usually is supposed to be a different date, where now all the parties are just coming to sign. There should be nothing to discuss. Maybe we're just coming to just say jump, and maybe it's supposed to be a signing ceremony. So I think with the guidance of the chair, we can agree on a scheduled date for the two meetings, the virtual one, and now the official signing, because I think we've shown that willingness to come in and ensure that we have these things done. So I think with the guidance of the chair, we can agree on the two meeting dates, the virtual ones and the ones now for the official signing. Because I don't think we have a problem with anything that have been raised by in that thing. Only there are a few issues, and then the chair you can now maybe guide us going by your request, so that we also allow you to do other things. I know you are very busy. Your office is very busy, particularly today. Actually, seeing us is a great honor, and we don't take it for granted. It's a great honor. In fact, to dear PHOs, we were treated so well. It's a great honor, and we don't take it for granted, and thank you so much. So we can get those two virtual dates, which are those two vital dates which are very important for us, so that now we can fix, and then we go and plan. Because the chair has actually stated his position.
If I may, remember like when we were saying for 2 weeks.
Like today's 4, for example.
Now, what I'm saying, yeah, we need to think of one. Ours is there is the issue of the signing,
Yes.
but we need now that technical team from your end, because like I think the one we did with the nurses, where we had the counter attorney's office, we had the HR,
Yes.
and even the board was also represented by one of our HR. So now that team, first they looked at the documents, and you are from their end also. I think they had a legal person, yes, who looked. Now from there, they were able to hold their own and to polish everything.
I think, Chair, sorry for cutting you short. I think my understanding of the invite, the side of the attorney has looked at the document. That's why they've actually proposed areas of improvement. And those are the areas that actually we have also said, apart from a few, we have no problem. So it's a question of panel beating and brushing through the issues that have been raised, which are actually in black and white in the document. Then just agreeing on the date of signing. Because as we speak right now, the bit of the attorney has looked at it. On our side, we also looked at it. The areas we have proposed and we have agreed. So it's just a question of having that virtual meeting to brush through.
Okay.
Then once we agree,
yes.
then now once we are brushing through, then we set up and go for the signing.
So when can we have that online meeting?
What do you think?
But I would like you propose a date, but you need a tentative date.
Yes.
Because you see the people I need to bring on board.
Yeah, that's okay, That's
yeah,
okay.
so we just propose a date, then from there, awaiting confirmation, then from there we agree.
That's okay. Which date can you propose? Tomorrow is so soon.
Tuesday next week.
Let's have a virtual meeting down on Tuesday. Then on Friday.
Friday is holiday.
On Tuesday. Oh, yeah. So Tuesday might not be able to work. Wednesday, what's happening? Is it Wednesday happening? But it's a virtual meeting.
It's a virtual meeting.
The virtual meeting we can do it wherever we are. It depends on the timing. I don't know, Chair, which time you propose?
I want to
early morning.
Propose,
I prefer early mornings. Because late evenings, sometimes people are tired.
Business is done in the morning.
Well, let's say at 10 a.m. Will that work with you, Honorable Chair?
There's something what you say there.
Early morning.
Can we have someone? We continue.
Yes, please.
Early morning meetings will run very fast and they're very effective. Let me.
We are saying, we talk about 8
Yes.
Yeah.
8,
8 to 9.
8 to 9.
1 hour is enough. We don't need the whole hour.
Wednesday,
Wednesday.
9th.
We're going to set up the list.
8th.
Upon confirmation, you can now, I think, Purity, what you do, you get the number of the chair together with the team. You can agree on the link, and then you can get it. Yeah. Then now, I think after that meeting, you can now agree in the same meeting on the date of official signing. But I think we set up a date the date of the signing. I thought it's also good. In this meeting, we agree. I think on Tuesday, on Wednesday, when we have that, I think on Friday to the Kualini. Jamhuri Day. On Friday, the Jamhuri Day. 12. You don't show them? So we can send it on 15th, Chairman, on Monday. Before we
Let's first do our meeting on 10th. Then after that,
I need to November is next year. That's what I'm trying to do. When we make Peter 15, most counties scale down the operations and everyone to so we will not wish to get beyond 15 with the humidity. So that we have it done this year by 15.
We enter the year on a high note.
So that next year nikutana naye chairman tunakunywa chai ama coffee pale tukiongea tulisaidiana.
Yeah, so but we will agree after 10.
After 10.
After 10.
Sio kama sawa. You know what you are saying, even 15 is tentative. It can even come before. Hata unaweza kuwa chairman unani that meeting goes with the chair and can even rule. Now that we agreed, mkuja kesho tusaini. Na hiyo kesho sisi tunakuja. Kwani si the following day tunakuja. Because once you have agreed, kwani sasa tunangoja muda mrefu ya nini na tumeshaya na I think with your wisdom you can always guide.
Yeah. Let's first have that meeting, and then from there we will be able to agree. But as you are saying, the issue of the signing of once we agree, the recognition agreement,
It should not be an issue.
is.
Otherwise, the last bit, we are grateful. Allow me to say thank you so much for your support. Please pass this the governor, the honorable governor, that the public health union supports his government 100%. We are grateful for the support you've given to our department, particularly the public health, in discharging our mandates. Sometimes we keep saying our mandates are not so loud, but sometimes they are very critical. You know, sometimes you might not see what our colleagues are doing until you have an outbreak, for example, of cholera or COVID-19, or then that we assessing what the importance of public health will do. Sometimes we do a lot of things. Bringing down disease burden is not easy. For example, in like a population around, is it 600,000 population. Assuming all of them fall sick, honorable chairman, we have enough facility to treat them. We don't. 600,000 hata workers wenyewe wanatoka wapi? So the best way then is to prevent and bring it down. So the best way to prevent is to employ PHOs who can now cut down the disease burden and have a healthy population free from cancers and diabetes and hypertension with this world. And to obtain diseases are prevented by the preventable. Me, I'm sure you will agree with this gospel and the next advertisement to prepare 200 PHOs at least to Ajiriwe so that we can cut down the disease burden. Nairobi did it, honorable chairman, to Ajiri 150 PHOs for a record. Nairobi did it. Kiambu walifuata. I know like KEHPHPU can do better. And you can also want to prepare me and big. Na hii smiling face yako, I'm sure. Just 200 slow. So amefurahi amecheka. So ameshakubali hiyo maneno. So chairman is a good person. We are great.
What you are saying, we are going to end it like now. Your colleagues who are in public health department. You know, recently we did the sub-establishment.
Yeah.
And we also, it is for also, you know, ideally, the county public service board, the request comes from the department.
Exactly.
It does not come from, it's not us to initiate. As they just bring the ident,
And then
yes, and we go ahead with the recruitment. So we also at the departmental level, we also need to.
But I'm also sure, Honorable Chairman, going by the health needs assessment, you can do a survey and say, at a department to the entire, we have a feeling as the employer that something needs to be done in this area. I'm sure you, I'm not saying you can do, but you can always advise, please go and do something in this area, because this area has been a grey area, not actually touched in this area, particularly on public health. So,
there are quite a number of activities which is happening. The issue of the staff audit.
Yes.
And so we are, by next year we'll be getting a report on what is the position of the ground. And as you had said, if we can be able to prevent
better. In the fact that
everything else.
Unataka pesa kujenga barabara. Punguza tu.
If we can be able to
utapata tu hapa. Unajua we generate.
So what I buy your argument. It's true. It's the truth. Because if we prevent all these other investment which we are doing, we can channel to other areas. So we as the board, we are going to support, and also the people who are on the ground. We also need you people to be felt. Yeah, it should be felt. And so even when we talk about, you know, like now we have been having this argument about the agriculture offices. That when you you do the audit in the barazas, you ask where are they? The farmers don't know them. So with the public health, they should be felt. Now from there, everybody will be able to say that we need more. We are opening new marketplaces and all that. So we need more public health officers and all that. So we'll assist where we can, but you have also a very big role to play to make sure that you are felt on the ground.
Yes.
Also, one thing that we want to add is, majority of those who have retired, those who have found greener pastures, those slots are usually there. So the way to enshrine it very well to safeguard the interest. Because I know in some areas we are having problem. Somebody retires, the slots of public health be according to other candidates. So we want you to, in your discretion also, to protect us, because I know it is always there. So, like for instance, a person retires at a job group P. That means it can employ almost 3 or 4. So with that, I think we will have even more manpower, even to work with the resources that we have within our stores. Then from there now, with your blessings, unatuambia hizi zingine tumeongezea hapa, tunajaribu kubudget ka wage bill kidogo ndio hii tumeongezea. So you will also help us in terms of even having the numbers in a justifiable manner, because hapo ni discretion and resources. So it's about realigning. Even other areas, we have entered some areas, they have taken resources, then they analyze just say the service need. After that, they know this area needs more than, we already have more doctors, we have more nurses, this money we have, now let's employ this, then we do that, and it has worked better in other counties. And having a leaflet is always, because even other counties have done, analyze your plans that you have done for the HRH too. They have analyzed yours and we have heard stories about what you have done. So they are doing a benchmark from yours, and also it's the other way around also. It's a way of life also. So we are hoping for the best, to shake and corner, guide us, and also at the same time we will protect our community and the community at large. Yes.
So
actually maybe just to add on something, you can build so many hospitals but if we can just prevent, even there's no need to build many hospitals. If you go to developing countries and developed countries, doctors are now studying public health because people are not falling sick. Actually, hospitals are being converted to learning institutions.
It is true.
It's
true.
Yeah.
Yeah,
So if
developing
you
countries.
prevent, actually, we get it right. But if you can employ so many doctors, so many nurses, but you will not still solve the problem.
Yes.
And the problem is just to prevent so that people cannot fall sick.
The root causes.
They can be productive and they can actually grow this country.
That's true.
Yeah, but if we think creative and eat creative, we will not make this country grow. Let us think preventive. That's
True.
like Britain say. Creative is better than
Cure. Prevention.
better than creative.
On top of your employer.
Well,
So, you are boss.
So we can take a photo. You can take a photo of the chair, and then I think we have agreed in most issues, right? Unless if there's an issue with the branch. Na Kariuki msupport chairman. Siku nyingine mnampigia simu. Bwana usikuja bwana strike notice.
Kariuki, I know you sympathize with me. The workload which has
A lot of it. Yeah. So we can start again.